In the last 9 months, in our review of all of the literature as a group, again, we are some of the most highly published physicians in our specialty and the world. We have done nothing but try to figure out how to identify a repurposed and available drug to treat this illness. We have now come to the conclusion after 9 months, and I have to point out, I am severely troubled by the fact that the NIH, the FDA, and the CDC, I do not know of any task force that was assigned or compiled to review repurposed drugs in an attempt to treat this disease. Everything has been about novel and or expensive pharmaceutically engineered drugs, things like tocilizumab and remdesivir and monoclonal antibodies and vaccines. We have 100 years of medicine development. We know we are expert in all the medicines we use, and I do not know of a task force that has been focused on repurposed drugs. I will tell you that my group and our organization, I will say that we have filled that void. That is all we have done, is focus on the things we know and things we do. And I'm here to tell you, Dr. Reiter, he just presented. He has one study of the many that I want to talk about. And I want to talk about that we have a solution to this crisis. There is a drug that is proving to be of miraculous impact. And when I say miracle, I do not use that term lightly. And I don't want to be sensationalized when I say that. That is a scientific recommendation based on mountains of data that has emerged in the last 3 months. When I am told, and I just had to hear this in the opening sentence, that we are touting things that are not FDA or NIH recommended, let me be clear. The NIH, their recommendation on ivermectin, which is to not use it outside of controlled trials, is from August 27th. We are now in December. This is 3 to 4 months later. Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. It basically obliterates transmission of this virus. If you take it, you will not get sick. I want to briefly summarize the data. My manuscript, again, published by some of the most, we have contributed more to the medical knowledge of our specialty in our careers than anyone else can claim as a group. And our manuscript, which was posted on Medicine preprint server, details all of this evidence. I want to briefly summarize it. Number one, we have evidence that ivermectin is effective not only in prophylaxis, in the prevention. If you take it, you will not get sick. We just came across a trial last night from Argentina by the lead investigator of ivermectin in Argentina, Dr. Hector Carvalho. They prophylaxed 800 healthcare workers. Not one got sick. In the 400 that they didn't prophylax with ivermectin, 58% got sick. 237 of those 400 got sick. If you take it, you will not get sick. It has immense and potent antiviral activity. We know that from the first study in Monash, it has made the bench to the bedside. Prophylaxis, we now have 4 large randomized controlled trials totaling over 1,500 patients, each trial showing that as a prophylaxis agent, it is immensely effective. You will not get sick. You will be protected from getting ill if you take it. In early outpatient treatment, we have 3 randomized controlled trials and multiple observation as well as case series showing that if you take ivermectin, the need for hospitalization and death will decrease. The most profound evidence we have is in the hospitalized patients. We have 4 randomized controlled trials there, multiple observation trials, all showing the same thing. You will not die, or you will die at much, much, much lower rates. Statistically significant, large magnitude results if you take ivermectin. It is proving to be a wonder drug. It has already won the Nobel Prize in Medicine in 2015 for its impacts on global health in the eradication of parasitic diseases. It is proving to be an immensely powerful antiviral and anti-inflammatory agent. It is critical for its use in this disease. We, again, stand by our manuscript. It is a scientific manuscript. It's been submitted for peer review. But please recognize peer review takes time. It takes months. We do not have months. We have 100,000 patients in the hospital right now dying. I'm a lung specialist. I'm an ICU specialist. I've cared for more dying COVID patients than anyone can imagine. They're dying because they can't breathe. They can't breathe. They're on high flow oxygen delivery devices. They're on non-invasive ventilators, and or they're sedated and paralyzed and attached to mechanical ventilators that breathe for them. And I watch them every day. They die. By the time they get me in the ICU, they're already dying. They're almost impossible to recover. Early treatment is key. We need to offload the hospitals. We are tired. I can't keep doing this. If you look at my manuscript, and if I have to go back to work next week, any further deaths are going to be needless deaths, and I cannot be traumatized by that. I cannot keep caring for patients when I know that they could have been saved with earlier treatment, and that drug that will treat them and prevent the hospitalization is ivermectin. I am here today. I'm calling to action. The NIH, their last recommendation was August 27th. August 27th. I want to be clear. I am not here as a politician or a dramatist or sensationalizing what I'm recommending. I'm going to be very clear and very simple. All I ask is for the NIH to review our data that we've compiled of all of the emerging data. We have almost 30 studies. Everyone is reliably and reproducibly positive, showing the dramatic impacts of ivermectin. Please, I'm just asking that they review our manuscript.
Should I say more? Who is running this country?